My name is Dr. Salil Patel. I'm an interventional cardiologist with Baptist Heart Specialists. PE stands for pulmonary embolism. So that's a blood clot that goes to the lungs. It's similar to a DVT, which is a deep vein thrombosis. So DVT and pulmonary embolisms are part of the same spectrum of disease called VTE, or venous thromboembolism. That's when you form a blood clot in the venous system. So typically you'll have a blood clot that forms in the veins in the legs, and then it might migrate up from the legs to the IVC, and then it gets entrapped into the lungs. So that's when it's called a pulmonary embolism. There's a lot of, risk factors for VTE. Being sedentary, having any kind of recent surgery when you're kind of incapacitated, not moving around very well, that can predispose you to forming blood clots in your legs. And then once those form, those can migrate to different parts of your body, typically up to the lungs. So any kind of recent surgery, some people have a clotting disorder where they're actually genetically predisposed to forming blood clots. But typically after surgery or being indisposed or traveling, when you're sitting in one position for a long period of time and not moving, that's when the blood kind of stagnates and you can form clots in the leg veins. So typically signs and symptoms of deep vein thrombosis are swelling of the legs. You can have swelling, redness, pain in the legs. And again, that typically sometimes will happen after a recent trip or something like that, and that actually is an indication that you might have a blood clot in your leg. When that blood clot travels to the lungs and becomes a pulmonary embolism, those patients typically have shortness of breath. Sometimes they get chest pain. They can have chest pain when they take a deep breath. That's called pleuritic chest pain. Their oxygen levels can drop. So there's really respiratory symptoms are predominant when people have a pulmonary embolism. And when the blood clots are in the leg veins, typically you have pain and swelling in the affected limb. If you think you're having a blood clot in your leg or in your lungs, a DVT or PE, you should probably go to the ER right away because you want to get that diagnosed quickly. If you have a lot of clot burden or a lot of clot in the leg, you can have some severe swelling and it can compromise the blood flow to the leg. So that can be a significant abnormality or emergency. If you have a blood clot to the lungs, those can be very serious complications because 25% of people who have PEs actually present with death or sudden death because they die from these things. So there's a high mortality associated with some of these clot conditions when there's a lot of clot there. If it's a little bit, it's treated very conservatively. If it's a lot, there's some more aggressive therapies. But it's very important to get the diagnosis soon. So seeing your primary care doctor is important, or talking to them is important, but they're going to send you immediately to get some imaging done because once a diagnosis is made, you need to get started on some medications to treat that, primarily blood thinners. So there are some things you can do to avoid blood clots. Namely is when you're traveling, make sure you move around. You want to activate the leg pumps in your legs. That's why when you're traveling for long periods of time, they tell you in an airplane, for example, to get up and maybe every half an hour move around, or when you're traveling by car, stop every hour or a couple hours and get up, walk around the car or take a break. And that's important to get the blood circulation in the legs. When you activate the leg pumps, it starts to push the blood forward and it prevents kind of stagnating of the blood and pooling of the blood in the veins. So that's important. After surgery, sometimes the doctors will put people on some light doses of anticoagulants or blood thinner medications to try to prevent the risk of clot after basically namely knee surgeries and orthopedic surgeries. So that's something the physician will institute. But it's important to just be active and move around. Again, some of these clots typically form after being in a stagnant position for a long period of time. So that's why you want to be active and move around. It's important to get your doctors involved with diagnosis and treatment of DVTs and PEs. If you have a lot of clot burden in your legs, there can be some compromise of the vascular flow in the legs, and typically the treatment is mainly putting on blood thinners. But if there's a lot of clot and there's a lot of compromise and the patient is very symptomatic, there are some therapies that can be done to remove the clot and alleviate that obstruction. And there are some interventions that can be done where we can go in there and dissolve the clot or physically remove the clot with large catheters. And that's important depending on the amount of clot that's there and the symptoms that you're having. Same thing with the lungs. When there's a lot of clot in the lungs and it's putting some stress on the right side of your heart, typically the management of this is blood thinners, but when there's an extreme amount of clot burden and a significant effect on the right side of your heart, we can actually go in there and remove the clot, either immediately with some kind of suction device, or we put drip some medications in there to dissolve the clot quickly. And that increases the forward flow from the heart into the lungs and reduces the stress on the right side of your heart. and we're hoping that downstream that this can minimize the risk of some complications. People ask about how is this related to the heart and the heart disease. When you have a blood clot in the lung, that actually, if you have a lot of clot burden, that can actually put stress on the right side of your heart and cause what we call RV strain. So a large amount of clot burden to the lungs actually ends up being a heart issue because it compromises the heart function, the right side of the heart function. And when that gets very severe, that can be very dangerous and life-threatening. The more blood clot, the more heavy clot burden you have in the legs and even in the lungs, that's the more stress it can cause on the right side of your heart. And those patients are the ones who actually do very poorly. When you have a small amount of clot, it doesn't put much stress on the right side of your heart, and the downstream consequences are negligible, and those people do quite well. But if you have a lot of clot and it starts to affect the right side of your heart, that's a very serious condition, and that needs to be treated, and so you can mitigate downstream complications. So when you have a blood clot in the legs or the lungs, it's important to have follow-up with a physician such as a cardiologist. If you have the condition in the lungs, a pulmonary embolism, it's important to follow you downstream to see if there's any complications, if you're getting some high pressure buildup in the lungs, and that's something a cardiologist can follow up and manage. Same thing with the legs. When you have DVT in the legs, sometimes those symptoms go away quickly, but about a third of patients, and sometimes up to 40% of patients, can have chronic symptoms from having a blood clot in the leg. That's called post-thrombotic syndrome. And sometimes that's easily managed or mitigated by wearing compression stockings, but if you're not seeing a physician, you might not get that advice. So it's important to follow up afterwards to get some chronic ongoing management for some of these conditions, even if you're feeling better.